integration.
What can work in Kenya now? Let them go to private health care dispensary, get free medicine, treat malaria free, then maybe lifetime disease, they can pay. It was a crisis. But general population, they can get free medicine and go. And go with what the doctors say. And others have to pay for these people. You are saying who's going to pay? What is going to work in Kenya is that so long as the economic rights is not working, others are going to have this burden unless our policy is going to give them a change that and many and there's somebody else.
Great. And I'm thinking, if I'm getting it right, we're looking also at digital, no inclusion in the digital front, because again, if you bring the ID prospect, you have lost out on a very big population. There is no information coming out into the indigents and the underprivileged. So we are moving along with an authority or a system that we're leaving millions behind because of lack of understanding. And then, of course, you're raising an issue of free primary health care, which is also very, again, begs the question, what happened to cancer? But story for another day. And I hope the panelists will be able to listen to these interactions. And looking at SHA and in the precedents that it's trying to bring, is there anything in SHA, before we get to your questions that I asked earlier, is there anything in SHA that has addressed anything you've had in that discussion? Jamhura. The issues that have been raised by the husband, the pregnant woman, the child, etc. Is there anything that has been mentioned that SHA is answering?
So I'm going to give a very lawyer response, and I will say, let's go back to what Dr. Kigondo told us at the beginning when he said health financing is only one aspect of the whole spectrum. So financing can stand on its own. Somebody referred to not the policy or the framework, but the fact that there's a guarantee that when they go to hospital, they are going to get the service. Someone else mentioned the hospital itself existing and it being near where they're staying. Someone else has said there's no need for unique identification simply because I am a Kenyan and I am in Kenya. Actually, the language used in SHA is not Kenyan, it's person. Person resident, yes.
The language is resident.
Yes.
So you don't even need to be Kenyan.
Yes, you don't even need to be Kenyan. In fact, I remember when we were analyzing the law and we were looking at what other laws have been affected, is that now if you need to get a work permit for somebody who is not Kenyan and they're coming into Kenya, the other extra thing you have to work out for them is registration for SHA if they're here for a certain, is it for longer than 6 months? Or 9 months for a certain period of time. Yeah. So any person present in Kenya, and this is not a surprise because it matches the language in Article 43, which is every person is entitled to. So this, we are very sorry for the requirement for unique identification. This has also been previously identified as a likely problem in the petition in the High Court. The one that was questioning, the very first petition, the one by Enoch Aura, the one that was questioning the need for unique identification. So we are saying, let's even say you need to identify yourself. Don't you already have an ID? Why do you need a secondary one? So yes, we should totally do away with the requirement for an ID, especially because, you know, all border counties, I think the people who are born there have to jump through hurdles for them to get national identification. They have to go into interviews, and there are boards which go around. I know this because I went to school with some people who are from Kwale County, and there was also always the question of whether they are born in Kenya to Kenyan parents, etc. There should be no requirement for citizenship. So health financing is one very small aspect. All these other things need to go together. What SHA does is the mandate for SHA, and even when you look at the instrument creating it, the Social Health Insurance Act, as Dr. Kigondo put it, collecting the money and handling the claims. But it's not to work alone, it's to work together with other functions. So please mention Ministry of Health because that's your policy making function. I haven't heard us talk about the county governments. Do we know that health is partially devolved in Kenya? Yeah. So when we are looking at SHA like this, can we also talk to our governors? Right? Because community health workers is a primary health care function. We are saying we want the service to get to where someone is, right? and we are saying that they need to be empowered, right? We said capacity build them so that they're able to respond to a very, because of the referral system that exists. So, primary healthcare function, if you look at Schedule 4 of the Constitution, is business of county government. But now there's a tussle between national and county governments over who, because if you pay the piper, you play the tune. Who holds the money for community health workers and who is sending them out into the field? There was a bunch of clinical officers the other day who were striking because they said they were deployed to go and deal with tuberculosis and other infectious diseases on the ground, and now several months later they have not been paid for quite some time. Health can't stand alone, unfortunately. It's like if you want to hold your five fingers like this, right? So it can work alone. Social is just one component of the whole. Thank you.
Rene.
I have to answer. I'm going to be all the people. I'm going to be the child, the husband, the pregnant woman. I'm even going to add some other people onto this mix of ours. Because we're an African society. Let's stop acting like we're not. Private insurance takes care of mother, father, 4 children under the age of 18. Public insurance takes care of mother, father, up to 6 children under the age of 18. Who do salaries in Kenya take care of? Every single salary in Kenya, according once again to the CPK, takes care of is supporting at least 10 other people. Those 10 other people are not all under the age of 18, nor are they directly correlated to the salary holder. My house helps illness. Whose problem is that? Financial. It's a me problem. Her child's illness. Whose problem is that?
Yes.
It is a me problem. Auntie Lani, whose problem is it? My own mother, my mother-in-law. If I have been blessed with a grandparent, whose problem is that? Therefore, if you have decided that that is your problem, and I don't know which family you come from where that will not be your problem if you have a salary, we need to reconstruct this thing to reflect our reality. I think it was you who said that, or maybe somebody else who said that. Okay? So, you see that in Kavenduya they're paying you goods.